Enough with Thanksgiving, it's National GERD Awareness Week.
Yeah, maybe you're familiar with the effects of acid reflux on your body, but what about your teeth? Dr. David Shavlik, otherwise known to his patients as Dr. Dave, is here to talk about it. Good morning, Dr. Dave.
Good morning, you too.
Let's start by having you talk a little bit about what acid reflux is, and I think there's probably a misconception that it only affects perhaps older folks and maybe just men, but that's not really the case.
Acid reflux, or GERD, it's called gastroesophageal reflux disease. It affects 7 million people in the United States, all ages. From infants to elderly, no one is really immune from it. It's that feeling, kind of that burning feeling of fullness that we get in our chest after eating or sometimes at night. Acid reflux, or is caused when the esophageal sphincter, which separates our stomach from our esophagus, allows stomach acid to seep out.
Okay. We know those physical effects, but what does it do to your teeth?
To our teeth, it essentially causes erosion and permanent loss of tooth enamel. It can lead to mouth pain or irritation. It can lead to tooth sensitivity to certain foods or beverages. It can lead to the edges of our teeth becoming thin and breaking off or chipping. Sometimes teeth can look a little bit grayer as well, too.
Oh.
People who have that can, there's an increased susceptibility to tooth decay and gum disease. And if it's left untreated, it can lead to esophageal cancer.
Yeah. Now let's talk a little bit about the connection between GERD and a sleeping disorder, I guess, if you will, which is teeth grinding.
Yes, as well as sleep apnea. Those types of things can lead to headaches, can lead to jaw pain. Toothaches can result, broken teeth, and in some cases, teeth can be lost.
So why are dentists often the first ones who pick up on this acid reflux? What is it that you're actually looking for?
Well, often the symptoms, people aren't real, the symptoms aren't severe, they're very mild. And things that we look for and can see at a professional dental exam are wearing of the back molars, or we look at the backs of upper front teeth and we see some wearing and different signs there.
Okay, so, it not only helps you go to the dentist to, have your good teeth, but you might find a diagnosis. Let's talk about people who have acid reflux, how they can combat that on their teeth, the effects of it on their teeth.
Basically, good oral health is the biggest thing.
Okay.
Brushing twice a day, 2 minutes, using a fluoridated toothpaste that is approved by the American Dental Association, flossing daily, a well-balanced diet. I mean, there are nutritious acidic foods like tomatoes and citrus, and those can cause enamel loss. But combining those or using those along with a meal often helps too. There are different toothpastes that can be recommended, higher prescriptions of fluorides, modification of diet.
Okay, some good advice.
Good tips. And if you want to find more information, you can do that at WDA.org. There you're going to find a free quarterly newsletter called Tongue in Cheek and Teeth Too. And you can look on your oral health for sensitivity information. You can also find a dentist. You can also try mouthhealthy.org. Pretty easy websites to remember. We'll be right back. Thanks so much.
Thank you.